Welcome back this midday. It is Tuesday. Of course, our Two Works for You dentist, Dr. Kevin Winters, here to answer your dental questions regarding your dental health. Welcome.
Thank you. Thank you.
Well, let's get right to it. Jessica put her question up there. She says, I read something about how gum disease can be related to heart disease. What can you tell me about this?
Yeah, you know, there's really a lot of information about that. And it's been in the medical community for some time now, but the public as a whole really doesn't know a whole lot about this. But one thing that's a very definite connection is some of the origins, some of the ill effects of heart disease can directly be related to bacteria that are found only in your mouth as a part of gum disease. And so how does that affect your heart? Well, the bacteria then enter your bloodstream and then collect in your heart and contribute to the problems that we find with heart disease. So, you know, a little bleeding gums, or, you know, listening to your hygienist about you have some problems here and you're like, it's not that big a deal, actually can be a very big deal. So just one more reason to follow your hygienist's instructions.
I always follow them closely.
That's good.
Next question is from Sarah. She says, my dentist told me I need a crown on a back tooth. Couldn't I just get a big filling?
Yeah, well, you know, when we make decisions and recommendations on what to place on back teeth, which with your back teeth, they got to be strong. You know, you chew and you crush food hundreds of times a day, day after day, and so we need strength back there. And fillings are made to go to a certain point because of the strength that a filling can have. The larger the hole in the tooth gets, the less strong the tooth becomes, and so you need to modify the recommendations. So you can fix back teeth with a filling, you can place a crown, or you can place what's called an onlay. It's kind of an in-between scenario. So in whatever the recommendation is, it's always coming from the matter of what's going to make this tooth strong, so down the road you're not dealing with more involved and potentially more expensive problems.
All right, thank you very much. And final question here is from Dalton. He says, I recently had a porcelain veneers placed in to improve my smile. I'm not happy with many things, especially the color. Can I bleach the veneers?
Yeah, well, unfortunately, no, you cannot. You know, porcelain isn't going to change color. It's the color that it is. The only thing that could be done possibly would be to do some recontouring of the veneers to help improve things that way, but the color is what it is. So, you know, some recommendations, and it's kind of after the fact now, but you need to look at, in having that process done, is making sure that the shape of your temporaries are what you want it to be, because that can kind of serve as the blueprint for the final veneers. And also have a lot of discussion with your dentist ahead of time about color and things like that, so you end up with the result that you want.
All right, thank you very much. Thank you very much, Dr. Kevin Winters here. If you have any questions for Dr. Winters, just post it to our Facebook page at KJRH TV. Kirsten, Tanaya.